Let me start with a very honest question. Have you ever experienced that kind of itch down there that catches you outside and you suddenly squeeze your legs together just to control yourself? You know that types that comes out of nowhere, at shop, at work, at church, and you're just there crossing your legs tight, pretending everything is fine, but deep down you are thinking, God, please let this thing stop. If that's ever happened to you, please don't be embarrassed, because here is the truth. You are far from alone. Statistically, about 75% of women will experience vaginal thrush at least once in their lifetime. And half of those women will experience it more than once. In fact, around 5 to 8% of women suffer from recurrent thrush, meaning it keeps coming back several times a year. So if you are going through this, millions of women across the world, in UK, US, Africa, everywhere, experience it too. It is common, it is frustrating, and it is very treatable. And you are not dirty, you're not doing something wrong. Your body is simply responding to changes and imbalances. And today, we are going to unravel all of it. I'll say it again. If you have ever felt that embarrassing itchiness or that burning irritation that makes you uncomfortable sitting, standing, or even walking, if you've ever treated thrush and disappeared only to come back again and again, just know that you are not alone. Many women go through this quietly. Something is wrong with their body. Some are tired of buying Canesten every month. Some don't even know if it is thrush or something else. So today we are breaking the silence. We are breaking it down session by session. We'll be talking about why thrush keeps coming back, the habits, foods, and daily routines that trigger it, what to stop using immediately, the hidden medical reasons behind recurrent thrush, and how to treat it properly so it doesn't return, and how to protect your vaginal health long term. You don't want to miss any aspect of this video. Yes, you really don't want to miss any aspect of this video. Let's start this journey together without shame, without fear, and with full understanding.
I think I found it now. What I've been looking for. Isn't it beautiful? It's got my head all up in the clouds. I think I found.
Hello, my beautiful people. Welcome back to the channel. Thank you so much to all my amazing and wonderful subscribers. You are the real MVPs. I appreciate you so much. And if you are new here, my name is Esther, and I use this channel to educate us on practical, evidence-based health information covering general health, motherhood, and well-being. So please, click that subscribe button and support your girl. I beg, don't just pass by. Hit that subscribe button, please, and join this amazing family. Before we dive in, let me tell you a quick story. Few years back, a lady came to me. She's in her mid-30s. She's a busy mom, working full-time, and she said, Esther, I've treated thrush 5 times this year. The itching is back again. Is something wrong with me? She had used creams, pastries, tablets, everything. But guess what? Our recurrent thrush wasn't even thrush in the first place. It was what we call bacterial vaginosis mixed with irritation from daily panty liners. And that's the first honesty of today. Sometimes the reason it keeps returning is because it wasn't thrush in the first place. And we'll get to that. But first, let's talk about the real causes. Thrush happens when yeast, specifically Candida albicans, grows too much in the vagina. Candida is normally present in the vagina in small amounts, but it becomes a problem when something disrupts the balance of your vaginal flora. I'll explain further. Your vagina is supposed to be a well-balanced community of bacteria and yeast, but certain things throw off this balance and allow yeast to overgrow. Those things are exactly why thrush keeps returning. Let's break them down one by one. Let's break down the real reason why thrush keeps returning. Because thrush is not just about yeast, it's about your vaginal pH balance, the good bacteria your vagina depends on, and the little habit that keeps disturbing that balance without you realizing. Number one is if the pH balance of the vagina is being disrupted. The vagina has a natural pH level that keeps everything in harmony. When this pH becomes too alkaline or too acidic, the good bacteria, especially the lactobacillus, they become weaker, and this gives yeast the opportunity to grow. And things that can disrupt this pH include scented soaps, feminine washes, detergents, and fabric softeners, belching, daily panty liner, tight, non-breathable underwear. Once your pH is disturbed, thrush becomes easier to trigger and easier to return. Number two is if you are losing your good bacteria, the defenders. Men love smelling fresh, so they wash with scented soaps, shower gels, feminine washes, Dettol, antiseptic soaps, scrubbing inside with sponge. All these products, they destroy the natural protective bacteria, making it easy for yeast to grow back. Even mild or organic products can cause long-term irritation. So the rule is if it has fragrance, antibacterial action, or feminine wash written on the bottle, it is not for the vagina. Your vagina has good bacteria that act like security guards. They protect you from yeast, unwanted bacteria, infections, and irritation. When these good bacteria are killed off, then the bad bacteria and yeast grow freely. What kills the good bacteria? Antibiotics, harsh soaps, frequent washing, perfumed wipes, overcleaning, vaginal steaming, everyday panty liners, excessive friction or sweating. Once those good bacteria disappear, yeast grows back fast even after treatment. Number three on my list is antibiotics, especially when misused. They are a major cause. This is one of the biggest reasons for recurrent thrush, especially among African women. Antibiotics kill bacteria, but they don't know the difference between the bad bacteria causing your infection and the good bacteria protecting your vagina. They kill everything. So after taking antibiotics, many women experience itching, thick discharge, burning, and sometimes thrush that keeps coming back for weeks. Now, let's talk about something that is African reality. Like in many African communities, at least Nigeria, antibiotics are over the counter. Amoxicillin, tetracycline, Metro, Cipro, Augmentin. People buy them like paracetamol. Some even buy those antibiotics for small issues like cough or minor stomach upset. This self-medication destroys vaginal flora, weakens immunity, and creates the perfect environment for recurrent thrush. Even in the UK, doctors prescribe antibiotics when medically necessary. Because you have underlying yeast vulnerability, thrush comes back immediately after the antibiotics finish. Number four on my list is hormonal fluctuations plus disrupted bacteria. Perfect storm. Any change in hormones like period, pregnancy, breastfeeding, contraceptive, stress, they make the vagina more vulnerable. And if the bacteria is already low, thrush comes roaring back. Any hormone fluctuation can create the perfect environment for Candida. 1 week before your period, pregnancy, postpartum, using hormonal contraception, switching contraceptives, PCOS. This is why some women have thrush every month at a predictable time. All these factors combined, plus disrupted pH, weak good bacteria, and antibiotics misuse, plus hormonal shifts, are the real reasons thrush keeps returning, even when you think you've treated it properly. Another one on my list is diabetes or high blood sugar you don't know about. This one is major. Yeast loves sugar, so when blood sugar is high, even if you are not diabetic yet, thrush keeps returning. Symptoms like excessive thirst, tiredness, peeing a lot, sugar cravings, belly weight gain, recurrent thrush should be checked. Many women find out they have prediabetes after years of repeated thrush. Another one I would like to talk about is tight clothing and moisture. Candida loves warm, damp environments. You increase risk if you wear tight jeans, leggings every day, nylon underwear, synthetic clay, wet swimwear not changed quickly after swimming, sweaty gym clothes left on for a very long time. Cotton underwear is not just a suggestion, it's a necessity. Another one is diet high in sugar and refined carbs. This one is also huge but underrated. Food that makes thrush return include pastries, fizzy drinks, white bread, sweets and chocolate, biscuits, lots of fruit juice, too much alcohol, and over sugary snacks, chin, puff, and the likes. Thrush thrives when sugar intake is high. Also, another one is if the previous treatment is incomplete or incorrect. The painful truth is many women don't treat thrush properly. Common mistakes is using only the cream without the pastry, stopping treatment early because symptoms improved, or treating blindly without knowing if it is thrush or not, and not treating sexual partner when necessary, or using the wrong dose, not taking fluconazole when needed. If you don't treat thrush thoroughly, it returns like nothing happened, especially if you don't complete the dosage. Lastly, it is not thrush, it is something else. This is very common. Conditions often mistake for thrush as bacterial vaginosis, STIs like chlamydia or trichomonas, irritant dermatitis from wipes or soaps, eczema around the vulva, atrophic vaginitis, especially postpartum or during breastfeeding. Also, lichen sclerosus. The symptoms can look similar, so someone will keep treating it like thrush, but because it's not thrush, the problem returns. So let's talk about what thrush actually looks like so we don't confuse it with other infections. Before we talk about all the conditions that imitate thrush, let's make something very clear. Most women who think they have thrush actually don't. So let's break down exactly what true vaginal thrush looks and feels like so you can recognize it confidently. Number one is the discharge is thick, white, clumpy, like a cottage cheese. If you have real thrush, the discharge usually looks like thick white clumps, grainy or lumpy, similar to cottage cheese. Sometimes sticky, but no strong smell. It may sit in the vagina or come out in chunks on your underwear. If it is green, if it is yellow, if it is gray, if it is watery, frothy, smelly, that is not thrush. Secondly is the itching. It's always deep, intense, and embarrassing. Thrush itching is something else. It's not mild. It's not a little discomfort. It's that kind of intense itch that makes you rub your legs together in public. It can even force you to shift in your chair, or the one that wakes you up at night. It feels like something is crawling inside of you. It is one of the most annoying and unforgettable symptoms women describe. Number three is burning and soreness. Thrush often causes a burning sensation because the yeast irritates delicate skin. You may feel burning when you touch the area or when your urine passes over the irritated skin, or during or after sex. There's no deep abdominal pain. That's another issue. Thrush irritation is mostly on the vulva and around the entrance of the vagina. Number four is redness and swelling. The vulva can look bright red, swollen, shiny, and inflamed. Some women even say it feels raw. Also, one can have small cuts or crack. Because the itch is so intense, like I explained earlier, constant scratching or friction can cause fine splits, tiny cuts, little cracks on the skin, and this can sting badly when urine touches them. Number six is minimal to no smell. Real thrush does not have a strong or fishy smell. At most, it may smell slightly yeasty, like bread or mild sweetness, but nothing pungent. Anything smelly, that is not thrush. Lastly, sex can feel uncomfortable. Because everything is irritated, sex may feel too tight, burning, sore, and painful afterwards. This is due to inflammation, not dryness alone. So, putting it all together, you likely have true thrush if you have white cottage cheese-like discharge, intense itching, the one that you squeeze your legs type, burning and soreness, redness or swelling, tiny cracks from scratching, no strong smell. If this sounds like what you are experiencing, then you're in the thrush category. But if some symptoms don't match, then you are likely dealing with something else: bacterial vaginosis, irritation, hormonal dryness, sexually transmitted infection, which we'll break down in the next section. Now, let's talk about something many women don't realize. Not every itch or discharge is thrush. In fact, a lot of women misdiagnose themselves and keep buying thrush treatments over and over. Meanwhile, the problem was never thrush to begin with. So here are the main signs that what you are experiencing may not be thrush. Number one, the discharge doesn't look like cottage cheese, like I explained. Doesn't look like cottage cheese. Typical thrush gives thick, white, lumpy discharge, which looks like a cottage cheese with little to no smell. If the discharge you are seeing is yellow, greenish, gray, or frothy, it is very likely something else, not thrush. Number two is if there's a strong or fishy smell. Thrush usually does not smell. If you are getting strong fishy odor, sour or unusual smell, this suggests bacterial vaginosis or another infection. Number three is if you're having pain when you are peeing, like a burning urination. Thrush can cause external irritation, but sharp burning inside when you are urinating is more common with urinary tract infection, some STIs, or severe irritation. If pain burns internally, don't assume it is thrush because it's likely it's not. And number 4 is if you have lower abdominal pain. Thrush does not cause stomach or pelvic pain. If you have lower tummy pain, fever, back pain, general unwell feeling, it could be an STI, bacterial vaginosis, pelvic inflammatory disease, or a urinary infection, and not thrush. Also, number 5 is if the itching is extremely mild or not present. Thrush almost always gives noticeable itching and irritation. If itching is very minimal but discharge is abnormal, think beyond thrush. Number 6 is over-the-counter treatments are not working. If you have tried canesten, fluconazole, clotrimazole, and things do not improve within a few days or it keeps getting worse, it's a sign that it may not be thrush at all. Also, if you are sexually active with a new partner, thrush isn't sexually transmitted, but it can be triggered by sex. But discharge changes with chlamydia, gonorrhea, trichomoniasis. These STIs can mimic thrush symptoms, but behave differently. If there's a new partner or unprotected sex, get tested, no shame. Go and test yourself for all those STIs so that you will not be thinking it is thrush. Number 8 is there's intense redness, sores, or blisters. Thrush causes redness, but not blisters or sores. If you see small cuts, blisters, fluid-filled bumps, ulcers, this could be herpes, dermatitis, or a skin reaction, but definitely not thrush. Another one is if your period dramatically changes your symptoms. Thrush can flare after a period, but dramatic symptom changes may point to bacterial imbalance, bacterial vaginosis, or more related issues, not classic thrush. The bottom line is if your symptoms don't match the classic white, thick, itchy, no smell picture, then you might be treating the wrong thing, which is why the problem keeps coming back. If you have any of these, it's probably not thrush. Strong fishy smell, bacterial vaginosis, green or yellow discharge, infection, pain during urination, think UTI or STI, discharge not thick or creamy, likely not thrush, pain more than itching, check for other causes. Thrush treatment not working after 7 days, it's definitely something else. This is why getting the right diagnosis is key before treating. Testing is highly important. Getting tested is highly important. Now, let's talk about the part that nobody talks about, the everyday habits that silently keep bringing thrush back. Some of these things look innocent, but the vagina reacts immediately because it is extremely sensitive to changes in pH, moisture, and bacterial balance. Number 1 is using perfumed soaps, body washes, and feminine hygiene products. Many women don't realize that anything with scent, fragrance, freshness, colors, harsh cleaners can kill the bacteria, especially lactobacilli that protects the vagina. Once the good bacteria drop, yeast grows freely, which is thrush. So how do we prevent this? Wash only with warm water or a very mild unperfumed soap on the outside only. Never wash inside of the vagina. It self-cleans. That is, it cleanses itself. Number 2 is tight underwear and leggings. Wearing very tight clothing traps heat and moisture. Yeast loves heat plus moisture, so it multiplies quickly. The prevention is choose cotton underwear, give yourself breathable space at home, avoid tight leggings 24/7, and sleep without underwear when possible. Number 3 is daily panty liner use. Panty liners block airflow, trap moisture, and irritate the skin, especially scented ones. Prevention is you should avoid panty liners unless necessary. If needed, use unscented liners and change frequently. Number 4 is wearing wet clothes for long, like your gym clothes, your swimming suit. Sweating in the sweaty gym clothes or wet swimsuits creates a warm, moist environment perfect for yeast. So the prevention is change out of a wet clothes immediately, rinse off sweat, and keep the area dry. Number 5 on my list is using antibiotics too often, unnecessary self-medication, especially in Africa, such as Nigeria. Many people buy antibiotics over the counter for any small infection, but antibiotics kill both bad bacteria and the good protective bacteria, leaving yeast to take over. Hence, why thrush appears or returns after antibiotics. So the prevention is Only use antibiotics when prescribed. If you need them, if you think you need them, ask your doctor, pharmacist about preventing thrush at the same time. Ask your doctor. Number 6 is eating too much sugary food. High sugar equals to high glucose in the vagina, which is perfect food for yeast. Women often notice flare-ups after junk food, sugary snacks, high carb periods, excess sweet drinks. And the prevention is reduce sugar intake, add more water, vegetables, probiotic, yogurt if tolerated. Also, using wipes, deodorants, or freshness sprays down there. This product disrupts the pH and damage the protective barrier. Prevention is avoid wipes unless absolutely necessary. Stick to warm water or a gentle cloth. Number 8 is stress and lack of sleep. Stress weakens the immune system. Body can't control yeast overgrowth. The prevention is prioritize rest, hydration, and a calmer routine. Even 10 minutes of a quiet time a day helps. Number 9 on my list is wearing synthetic underwear. Nylon and polyester, they trap moisture and heat. So what do we do to prevent this? Cotton is queen. It absorbs sweat and allows airflow. So always use cotton underwear. 10 is using multiple products at once. Some women panic when they feel discomfort and start using vaginal gels, washes, creams, oils, antiseptics, salts, herbal mixtures. All this worsen irritation and trigger the growth of yeast. How do we prevent it? Less is more. Stick to simple, clean hygiene. Number 11 is sex without proper lubrication or irritation during sex. Friction can cause micro tears and changes the environment, which can also cause thrush. So the prevention is to use water-based lubricants, avoid perfumed condoms, and wash gently after sex. Don't scrub. Also, number 12, wearing pads for too long. During periods, pads trap heat and moisture. So how do we prevent this? Change pads more frequently. Consider using unscented pads only. So I'll summarize all the prevention. Use only simple hygiene. Warm water outside only and avoid perfumes or harsh products. Keep the area dry and breathable. Use cotton underwear. Avoid wet clothes. No tight leggings all day. Avoid unnecessary antibiotics. They destroy good bacteria, leading to recurrent thrush. Support good bacteria. Probiotic, live yogurt if tolerated. A healthy diet. Then reduce sugar. Yeast feeds on sugar. Change pads and panty liners frequently and avoid daily liners completely. Also, manage stress and rest. A strong immune system keeps yeast in check. And also, treat your partner if recommended. Rarely needed, but some couples ping-pong symptoms. Stop over-treating yourself. If you keep getting thrush every month, get a proper diagnosis. It might not be thrush at all. Now that we've talked about what triggers thrush, how to prevent it, now let's go into how to treat it properly. Many women fail to clear their infections because they treat incorrectly, stop too early, or treat the wrong thing. So how do we actually get rid of thrush and stop recurrence? Today I'm going to walk you through the safe, effective steps straight from a nurse perspective. Confirm it's really thrush first. Before starting treatment, check if the symptoms match the classic signs: the thick, white, cottage cheese-like discharge, intense itching, burning and soreness, redness or swelling, little to no smell. If symptoms don't match, get tested. You might have something else like BV, STI, or irritation. Why this matter is that treating the wrong infection just makes it worse. Number 2 is use antifungal treatment correctly. There are 3 main ways to treat thrush. Clotrimazole 1% cream. Apply externally around the vulva 2 to 3 times daily for about 7 days. Tip: do not insert the cream deep into the vagina unless instructed by your doctor. Focus on the external irritation. Also, pastries or vaginal tablets. Clotrimazole 100mg or 500mg vaginal pastry, depending on the one prescribed to you. Usually inserted at night for 1 to 3 nights, depending on the product. The tip is that you lie down for 15 to 20 minutes after insertion for best absorption. The oral tablet, fluconazole 150mg single dose, sometimes repeated after 3 days if severe or recurrent. The tip is only take oral antifungals if prescribed. Avoid self-medicating repeatedly. Number 3 is treat both internal and external irritation. Creams undo external itching and redness. Pastries undo internal yeast. And oral tablets address more severe recurrent infection. Most women skip the cream, which is why the irritation lingers. even if discharge clears. Take the full course. Symptoms may improve in 2 to 3 days. Do not stop treatment early. Stopping early allows yeast to survive and return quickly. Think of it like finishing antibiotics for a throat infection. It's just the same idea. Also, manage the environment of the vagina. During treatment, wear cotton underwear, avoid tight clothing, keep the area dry and clean, skip scented soaps, wipes, and panty liners. Change pads frequently even if you're on your period. All this helps you stop multiplying. Also, consider probiotics and diet support. Oral probiotics can help restore good bacteria. Live yogurt may help if tolerated. Reduce sugar and refined carbs and stay hydrated. Remember, yeast feeds on sugar. Supporting good bacteria and reducing sugar lowers recurrence. Also, identify your trigger. Notice if it occurs before your period, after sex, after gym, after antibiotics, or after certain food, or during stress. Your trigger helps you prevent the recurrence. And also, get tested if it keeps returning. Please do not guess. Do a vaginal swab if you have had thrush more than 3 times in a year. Number 7 is treat sexual partners if recommended. Not always necessary, but if your partner notices irritation or recurrent infection, consult a doctor. This prevents ping-pong reinfection. Number 8 is know when to see a doctor. See a healthcare professional if thrush occurs more than 3 times a year. Symptoms don't improve even after 7 days of treatment. You have diabetes, pregnancy, or immune problems, you need to see a doctor as well. Or you experience pain, unusual discharge, or salt, then see your doctor. Recurrent thrush may indicate an underlying conditions like diabetes, pH imbalance, or another infection. Also, don't self-medicate repeatedly. Repeatedly using creams or tablets without diagnosis can damage vaginal flora, cause resistance, and worsen irritation. Instead, treat properly once and check with a professional if it returns. So, what should we stop doing today? Stop washing inside of your vagina. Stop scented panty liners. Stop feminine washes. Stop tight clothing daily. Stop self-diagnosing every time. Stop repeating old treatments. Stop sugar overload. Stop wiping aggressively. Stop using Dettol, Safflon, or antibacterial soaps to wash the vagina. Your vagina cleans itself. Help it. Don't disturb it. For sisters frustrated with thrush, you are not dirty. You are not broken. Your body is responding to imbalance. With proper treatment and care, you can heal and prevent recurrence. The bottom line is for you to confirm symptoms first, treat external and internal irritation properly, complete the full course, avoid triggers while healing, restore vaginal flora, seek professional help if it keeps coming back. Do this and you will break the cycle of recurrent thrush once and for all. Wow, we've covered a lot today, from what thrush actually looks like to how to know when it's not thrush, to the habits that trigger it, and finally how to treat and prevent it properly. Now have all the tools to take control of your vaginal health. I want you to leave here knowing a few important things: that you are not alone. Thrush is incredibly common. Most women experience it at least once in their life, and many even deal with recurrence. It is not a reflection of hygiene or cleanliness. Millions of women go through exactly what you are going through. Also, you are not broken. Your body is responding to pH imbalances, bacteria changes, or lifestyle triggers. It's not faulty or shameful. Treating yourself kindly, understanding your body, and following the right steps can restore balance. And number 3, knowledge is power. Now that you know how to recognize real thrush, habits trigger recurrence, how to prevent it, how to treat it effectively, then you can break the cycle and protect your vaginal health long term. Number 4 is take action. Follow the hygiene and prevention tips we discussed. Treat thrush properly if needed. Seek medical advice if it keeps returning. Support your body with rest, diet, and good bacteria. Ladies, sometimes our bodies challenge us, but this doesn't define us. With knowledge, care, and a little faith, you can restore balance, comfort, and confidence. This is your journey and healing is possible. If this video helped you, like and share with a sister who might need it. Comment your questions or experiences below. I read them all. And please subscribe for more health content. Thank you for watching my videos. Stay empowered, stay confident, and take care of your amazing body. And I'll see you in my next video. Bye.
I think I found it now. I think I found it now. What I've been looking for. What I've been looking for. Isn't it beautiful? got my head all up